Hello everyone, my name is Michael Brooks. I'm the Vice Chairman of the Sullivan County Legislature, and on behalf of our Chairman, Rob Doherty, and the rest of the Sullivan County Legislature, welcome to today's Town Hall. With me are our usual guests, our County Manager, Joshua Potosek, our Director of Public Health, Nancy McGraw, and today's guest is someone that I'm very familiar with from my days on the school board at Tri-Valley. And she's an asset to whatever community she serves. And currently, she is Monticello's school board president. It's my honor to welcome Lori Orestano James to today's town hall, and we will indeed start with Lori. So, Lori, welcome, and tell us what's going on in Monticello and in your world, what it's been like these last couple of months with this pandemic.
Thank you very much. I appreciate the invite today from Chairman Doherty to be able to speak to you and share some concerns and important information going on in school districts, not only in our county, but across the state and nation. Before I start, I'd like to thank all of the frontline workers. They have been absolutely incredible as far as servicing. Those of you who know my background and my health concerns, I cannot speak highly enough about the care and the workmanship. I do have a friend of mine who is doing my shopping for both Bill and myself, but early on I was going in and I saw former students who were in those grocery stores and parents of those students who were in those grocery stores and cashiers and stocking shelves and things of that nature, going into my doctor's offices when I need to go in. Telemedicine does work for some things, but not for everything. And they have really just been amazing. From seeing posts from former students of mine who work for companies like Mobile Medic and nurses and just the work that's being done by these people, it's amazing. And with that, I'd like to start by saying, first of all, Happy Nurses Week to all the nurses who are out there. You're doing a phenomenal job, and we're very proud of the work that you're doing. And to my nurses personally, and to the nurses throughout the listening area, we thank you for that. But I also want to remind you that this is also National Teacher Appreciation Week, and nurses didn't get to be nurses without teachers. So I'd like to thank all the teachers and everybody who's in the education field who have been also on the front lines, and people are not necessarily aware of that because what they're hearing is schools are closed. That's correct. The four walls, the spaces within the four walls are technically closed. They're not even really closed. It's just that we can't welcome students and staff into those facilities at this particular time. And with that said, I want people to understand that those foods that are being delivered, those lunches, those breakfasts to families throughout the county, the education that's going on, all of that is taking place because schools are still operating. They are not closed. They are just looking a little different these days. And I'd like to be able to discuss some of that, but you know, teachers aides, bus drivers, secretaries, guidance counselors, OT, PT, administration, secretaries, and school board members are constantly striving to give the best educational experience that we can to students under these conditions. So with that said, I'd like to discuss the distance learning and what's going on with distance learning. You know, we've heard the governor say, you know, the Gates Foundation, and, you know, they're going to come in and rescue the world, and teleeducation is the new wave. Well, I'm here to tell you teleeducation is not the new wave. Teleeducation is a tool to help us in certain fashions. We could see teleeducation for a student who is sick. Instead of just taking a sick day, they don't come into the school building sick, they actually learn from home. We could see teleeducation to be used when a teacher is not well, to have the sub in the room, but to be able to have that teacher be able to possibly communicate with students. We can see flipped classrooms to be able to enhance learning opportunities, that we could develop more engaging activities for students. But the reality is, what's good for students, and I mean students of all ages, I've taught from kindergarten up to college age, for all students, The social interaction of what is education has got to remain in place. So with that said, schools were thrown this curveball, and I have to tell you, using a May analogy, they hit this one right out of the ballpark. They have done an incredible job, and with the limited resources that they had on hand, and the limited funding to make this happen. And make no mistake, the one thing that it cannot ever do is replace that connection, which is so necessary in the learning. I want you to think back to your own education. Who was that one person who connected you with the thing that is driving you today, your passion, your love? The reason teleeducation has even amounted to any success that it has gotten to is because 3/4 of the school year was already completed. So teachers and education support staff had already made connections with students. If this would have occurred at the beginning of September, that connection would have never been there. And make no mistake about it, the social emotional wellness of our students is of prime importance in any learning setting, whether it be during a pandemic or not. So I speak sort of from knowledge, and thank you, Mr. Brooks, for giving such a lovely introduction. But I want people to know that I'm not just the Monticello Central School District Board of Education president. I come to you with a wealth of knowledge, not only from the county, the state, but also nationally. Those of you who know me know my background in education, but for those of you who don't, I've been in the education profession for 37 years. I have served as a teacher both in the elementary and secondary level, as well as college level. I've been a middle school assistant principal, a middle school principal. I've been a high school assistant principal and a high school principal, and I've been a district level administrator and director of programs. I've been a school board member and now the president of the school board, and I'm currently a supervisor of student teachers at the college level for Ithaca College. I am also currently the state advocacy chair for the New York State Association for School Music Association. Many of you know that as NYSMA. I am the state president of the New York State Alliance for Arts Education. I'm the state secretary of the New York State Council of Education Associations, which is the umbrella organization to 47 member organizations, which include things such as the New York State School Boards Association, New York State United Teachers, the School Administrators Association of New York State Council of School Superintendents, social studies teachers, reading, math, art, PE, health, family consumer science, librarians, NYSMA, NASADA, which is the Art Teachers Association, and so many others. I serve at the national level as on the advocacy leadership force for the National Association for Music Education. I'm a member of the New York State School Boards Association, past president of the New York State Council of Administrators of Music Education. I serve on the New York State Education Department Every Student Succeeds Act think tank, which is the law of the state of New York and federally for providing school services. I also serve on the New York State Executive Blue Ribbon Committee for alternative graduation pathways in the arts, and that's just to name a few. So I have a broadband spectrum, and I spend my day on a computer in meetings and doing such. So I want to speak to you from what I'm hearing from my colleagues around the state, the nation, and the county. I need to say distance learning is working for now. It is not perfect. And it is only working to the extent that it is because of the dedicated educators doing their best under these circumstances. But in reality, kids will ultimately be affected, and not in a good way. Issues exist, and the biggest issue that I am hearing, and it is so strong in Sullivan County, is broadband. In rural areas, the Rural School Districts Association has been fighting for broadband services for many years. It creates an inequity within our school systems that is like no other. I do want to take a moment to thank Senator Jen Metzger, who is on the Senate Education Committee. This has been a hot topic issue for her on her agenda since coming into office, well before this pandemic started. And now more than ever, she needs our support to help get this done. We have students, parents, and teachers, and you name it, who do not have connectivity, whether it be the cost of the service itself or the location that you are in. Pockets of Sullivan County get no service. I have a school board member who we sign in electronically. This particular school board member, because of where they live, they come in via phone, and I have to hold a phone to a speaker. She can't even attend the meetings in a Zoom atmosphere because there's an instability of that connection. How do we have education? How do we have equity in education through distance learning when we don't have the connectivity? I know of a specific family. I was speaking to Mr. Brooks earlier, and someone in his neck of the woods, 2 parents, working parents, 3 students, school age needing devices. They have 4 devices in the house. One of them uses a phone as the 5th device. How do you stay on learning all day long on a phone? And at that, it's a problem with the service because of where they live. There's a connectivity issue with the broadband. So all 5 can't be on at once, or they bump the other person off. So there's a definite issue with regard to that. In this particular time, and again, you heard my background, so obviously I do need to address music and art and PE and classes such as that. How do you do this online? When we're looking at how many people are doing posts of music and art, and how not only it is a message to us, but also what they're doing in their homes to keep themselves less anxiety and socially, emotionally well. It's coming through music and art and physical activity. You know, if we're at County 61 out of 62 with regard to health concerns, how do we not support the needs that are there for physical education for our students, and doing it via the system is doing it distance learning is not the best way to do it. It's not even on a scope of 1 to 100, it's rating maybe a 10 and being able to deliver to students. But to be able to do those types of programs and to really create lifelong skills and lifelong advocacies for those areas that keep us whole as a society, it cannot be done. The bottom line is that continuing on this way is not in the best interest of students. It's not in the best interest of the process. Socrates and Aristotle, you know, the learning in their classrooms, it was with people and students in front of teachers. And when I say teachers, please understand when I say teachers, I mean all educators. I don't just mean the teachers in the classroom, because without those support people in place, how do you do it? We have OT and PT that's being offered to students via telecommunication, that parents have to be in the room because someone has to manipulate the child for that particular work, the specifics, and you don't, and as the parent, you're afraid you're gonna hurt your child because you're not the specialist. So we provide those types of services. So there's so much more that cannot be done through this, but add in that concept of not having broadband, and we're missing a lot of kids. We're missing a lot of opportunities. We are getting packets out to those students, but it's just not the same. The other thing that I did want to quickly talk about, you know, cost is a major concern. School funding is an issue. We do know budgets across every place are going to take a hit. The only thing is that the only place that you get to vote on your budget is the school budget. All your other budgets are done by your boards. Boards of Education present a budget. You have the right to pass or not pass them. In short, things have changed. We will be doing an election on June 9th. You will be receiving absentee ballots with paid return stamps to send back your decision. Schools are in trouble. We are in a crisis just as everyone else is. Bottom line, someone paid for our education, and we are, as citizens, have to be responsible to pay it forward to educate others. If you have been following, you are aware that school districts are being asked to build a plane while it's in the area. We are required to set a budget without knowing what funds could be coming. We keep hearing things from the state level and the federal, but nothing has come down to us. That's true in the county and the villages as well, but we have to get a budget out there that we're going to need to follow. As I said, the vote will be for June 9th, and that's an order by, executive order by the governor. I can only speak to the Monticello Central School District on this particular comment I'm about to make, but I'm sure most districts are following the same suit. We are looking at a 0 or below 0 budget for this year. Please understand that that will absolutely affect us leading forward into the future with the 2% budget cap formula. But we understand that we can't put more pressures on the taxpayers. And we will figure that out as we always do. Our costs will go up, especially if we have to continue in this particular situation of online learning. But the budget is flatlined. So with that said, it is going to be one of those things where people are going to have to step up to the plate. As we said, in keeping our frontline workers safe, we wear our masks. We use hand sanitizer. We do what we're supposed to do. We wash our hands. That's how we keep frontline workers safe. We need to keep our students and frontline workers in the schools just as safe. And that means to provide them the supports that they need in order for them to have what it is that they need, are required to have to be able to perform their services. If we've learned anything during this epidemic or this pandemic, we've certainly learned that schools are truly the hub of a communication of a community. Not only from the learning aspect and the social emotional aspect, but certainly from the economic aspect. We've heard the governor several times say, and I don't like this comparison, but you can't have people back to work if you don't have people watching the kids. So knowing that that's the situation, we now more than ever must ensure that our schools have what they need to require to operate by keeping everyone safe while providing equity in education. Please support our schools. Again, a last time shout out to those wonderful nurses out there and to those teachers who taught them. And so as we thank everybody with regard to that, we thank the parents and community members who continue to support our students. And I thank each and every one of you for giving me this opportunity to share some of the situations going on in education. And because, like I say, hashtag it's about the kids. To all, stay safe, stay healthy. Thank you.
Thank you, Lori, for sharing your perspective. And the, listening to Lori, for me, it brings back memories of when I spent 12 years on a school board, and it's probably the toughest board one could sit on, but it's one of the, I think, probably the most important because we're dealing with our children, our future. And a school district definitely benefits from folks like Lori who decide to get involved. And I've always said if more people could spend at least one term on a school board to get an idea of the issue of public education in general, then whether reforms are needed, maybe they'd happen. When more people have a better understanding, not just with schools, but everything, it just helps everyone. We like to listen, we do listen to the voters, but by the same token, the public out there, the system doesn't work unless you engage, not with agendas, but just wanting to be part of the solution. And it's so important. At one commencement, I remember looking at the graduates and saying that I hope public service is in your future, perhaps, maybe, as a school board member. So with that being said, thank you once again, Lori. And we're going to move on like we always do with our first question, which is for Nancy. What are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested? Nancy?
Good afternoon. First I want to thank Lori for her comments, remarks, concerns. I think we're all very concerned about the impact that this has had on families and teachers and parents. Being a parent myself of a teenager, trying to homeschool and being in a rural area with sketchy internet, satellite internet, I certainly can relate to that as well as to all the families. So we thank you for your comments, and we're all concerned, and hopefully we'll get through this together soon. So the question and the update for today is that we have reached that mark of over 1,000 cases to date. We're at 1,002 positive cases since our first case was identified on March 16th. So that is an incredible amount of positive cases. And our staff continue to do a lot of work in terms of case investigation and isolation and quarantine. A total of 4,414 have been tested from Sullivan County. 1,142 are currently under quarantine. 1,521 have recovered, which means those who were positive are no longer on isolation and asymptomatic. We're currently at 25 total deaths, which has not changed since Monday. So we have not had any new deaths since Monday. That is good.
Thank you, Nancy. Next question, also for Nancy. Why is there such a high number of cases of COVID-19 in South Fallsburg, given that it is a small town compared to larger ones like Liberty and Monticello?
The town of South Fallsburg has been particularly hard hit and has highest number of cases. We are closely monitoring that situation and working to identify additional cases and providing isolation and quarantine and getting assistance in the way of food and other things to individual community members to ensure that they have what they need to limit further spread. There's a large percentage of the Latino community that work and live in that area who have been disproportionately impacted by this. Countywide, our population, Hispanic population, is around 16 to 17%. The town of South Fallsburg has a slightly higher percentage because of where they live and work. Also areas of Liberty and some in Monticello. Of our total number of positive cases to date, about 32% have been among the Latino community. So in comparison to population of the county that they represent, that's a disproportionate impact. We're working hard to build awareness and compliance and with safety measures, with the places where they work. We're working with state agencies and having a dialogue with these facilities about safe business practices, personal protective equipment in terms of face masks, hand washing, and we're working with community advocates to provide education in English and Spanish and to really try to make an impact in this community.
Okay, the next question is also for Nancy. How many COVID patients are in CRMC? What has been the highest CRMC census for COVID patients since this has started?
As of today, there were 16 COVID positive patients in the hospital. That is a decrease. I think the high at one point was 23. So only one new admission today, and 4 people were discharged yesterday with COVID. So that's looking better. There's only 3 people in the ICU who are COVID positive, and that's a decrease. We had a high of about 8 or 9 at one point earlier in this as we were tracking cases.
Okay, next question. I'm going to answer. What are the number of cases at Achieve in the Roscoe Nursing Home? As of Tuesday, there were 6 COVID positive cases or patients at Achieve and 0 cases at the Roscoe Nursing Home. Sorry. Next question goes to Nancy. That's a long one. Do you know how many residents from outside Sullivan County have been tested positive, are no longer quarantined, and are self-isolated? Cases of coronavirus are reported by the county of residents. So will we actually know how much of an increase Sullivan County will have in the coming weeks? Shouldn't we have a category for second home residents and camps if they open?
So some counties have different data sets that they track, although there's a common core consistency among counties. We don't currently have a way of tracking movements of individuals who are positive or in isolation and quarantine from outside the county to the county or from the county outside the county unless we become aware of that with our daily monitoring. But the state health department has a COVID data dashboard, a dashboard tracker on their website, which is health.ny.gov/coronavirus. On that page is a lot of information, and you can get information by county, as well as, the total number of tested by county. But when we get down to the county level in terms of data tracking, we've put together a pretty robust reporting system that I hope has been helpful, and we've gotten very good response to that.
Okay, next question is for Josh. These number counts are great. Thanks for all your hard work. I don't understand, however, how are the bungalow colonies open already? The social distancing order is still in place, and I'm seeing big gatherings of people in the colonies already. Our county has been great at containment so far, but surely this will exacerbate the good work being done.
Thanks, Mike, and good afternoon. Just like to echo Nancy's thanks for Lori. I think she had a wealth of information and knowledge, but to really hammer home the importance of broadband is vitally important. It always has been for this county, for economic development and some telehealth, providing telehealth, but now with the physical structures of schools being closed and kids being at home, it's certainly as important as it ever has been. And with my wife being a teacher, she's seen firsthand the inequity of kids that have broadband or not, and how difficult that is to really educate those without broadband. So I thank Lori again for her bringing that to light, and it's certainly something the legislature has made a priority to have broadband for everyone in the county during their term. To answer the question, I think that sometimes there's confusion between camps and bungalow colonies. Bungalows are seasonal residences that with no restrictions for people, whether it's a secular or non-secular type of seasonal residence. There's no restrictions there. Camps are regulated in this county, as we've said before, by the New York State Department of Health. And seasonal residences are regulated for when they can open in town, the various town codes that we have. So it's a local determination on when seasonal residences can be open. With everything else, if you see large crowds, we urge you to contact the New York Paws Task Force, and we'll investigate. But we haven't had any real issues that we're aware of with bungalows at this point.
Okay, thank you, Josh. Next question is for you as well. How do we handle people flying into New York State and coming here? Do they have to self-isolate or follow other guidelines?
There's no formal guidelines in New York State about air travel. The CDC has recommended and advised air travel only for healthcare or essential services being provided in their destination where those people are traveling. And so New York has not formally regulated travel into New York State or within the borders of New York State. So again, it goes back to being responsible and following all the executive orders. And if we do that, I think we can come out of this better on the other side.
Okay, next question is for Nancy. There are reports that some people who come here during summer months and have been positive for COVID-19 are saying that we need not worry about them coming here this summer because they already have the antibodies to the virus and say they cannot expose or contaminate anyone with COVID-19. Is that true? Does that mean that someone who has the antibodies and is fully recovered cannot transmit it to anyone?
So we often look daily, if not, every other day, for updated information and guidance from the Centers for Disease Control, the World Health Organization, and medical journal articles. Because the research is very early, it is very new, and this is evolving as well. So I had a discussion with our medical director as well, Dr. Ellswig, and we're of the opinion that there's currently not enough research that's definitive to show that once someone tests positive and is no longer infectious, or that they can't get it again, the antibody issue is still being researched and out there in terms of what the implications are. So it is not a simple answer at this point, and it's not true currently in terms of what we know, that if you have the antibodies to the virus, that you cannot continue to be infectious.
Okay, thank you, Nancy. Next question is for you as well. Are all masks the same, or are certain kinds better than others? What type is the best?
There's a lot of good information on the cdc.gov website regarding masks and the different types of masks. We recommend that the N95 masks be reserved for healthcare workers with direct patient care. But in general, the types of face coverings and masks that work well if you're going out into the general public are ones that, certain kinds of materials work better than others. You want to have at least 2 layers of fabric. You want to have something that's relatively easy to breathe through if you have it on for a prolonged period of time. It should cover your nose and your mouth without gaps, and it should, face go over your nose and sort of mold. Sometimes surgical masks or face masks will have a little loop or a little metal part where you can bend and mold it to your nose. Those with ear loops that go behind your ears or tie behind your head, are helpful. And the important thing is that your nose and your mouth are covered and your chin, and that it fits your face so that there's not gaps. Really depends on what you're comfortable with and what feels comfortable. And the important thing is when you take it off, be sure to take it off not from the front, but from the back, and to wash your hands and avoid touching your face.
Thank you, Nancy. Next question I'm going to answer. Can the county legislature pass a law stating that masks are required when out in public and social distancing must be adhered to, so that the law enforcement can give tickets for infractions, since I'm told the governor's executive order is not enforceable? Well, simply stated, at this point, at this juncture, the legislature is not entertaining passing any law with respect to that. I know this obviously comes back to the next question. Let me answer the next question, then I'll roll it all into one. Because the next question is, what is being done about all the barbershops sneaking clients into the back door while they are mandated to close? Simply put, like I mentioned before, the legislature is not looking to pass any new laws with respect to this. Personal responsibility, good decisions, common sense is what's needed at this point. Certainly, if you see something, there is the New York Paws Task Force that can be called, as Josh alluded to in a previous answer. But right now, I'm going to just go back to it. Take personal responsibility. Make good judgment when conducting yourselves in public. Next question goes to Josh. My family has had a summer-only cottage, second home in Sullivan County for 80 years. I have always made sure to buy local for groceries, gifts, gas, restaurants, household items, and services to support the local economy. Thank you. Plus, the library facilities and programming are excellent. Any idea when the libraries will be open? And any timeline on retail establishments opening? Josh?
That's a great question. Obviously, we've seen some information out of the governor's office about how New York is going to open on a regional basis. So they're aligned with the economic development regions of the state. That means Sullivan County is in the Mid-Hudson region currently. And each region has to come up with a reopening plan that they feel will work as a region. In some of the governor's guidelines, select retail, which is yet to be defined for curbside pickup, is included in phase 1. I think more retail is included in phase 2. So you could see more retail being opened once the county and the region meet the various medical metrics that we have to meet, such as increased testing, decrease in hospitalization, increase in contact tracing. So once that happens, I think you're going to see some more select retail opening. And I think we, as the economic development team and the recovery team have talked, if grocery stores, pharmacies, hardware stores can open safely, we certainly feel that retail can open. Libraries have not been defined exactly where they will fall in that continuum. Again, if we were talking about libraries with a curbside pickup, we feel similar to retail that they could be included early on in the recovery phase. But as of today, there's not a lot of clarity, but those plans at both the regional and state level are being developed and analyzed, and hopefully in the next several business days there will be a formal plan for our region on how to reopen.
Thank you, John. The last question for today, I'll answer. How can I help support Sullivan County during this time? Are there some volunteer opportunities? Thank you for asking. And the best place, because they have town and community networking, is the ECAC. That's our Emergency Community Assistance Center. It's headed by Laura Quigley. So please contact them at 845-807-0925. Once again, that's 845-807-0925. And with that, last few town halls I mentioned the census. It's still an important issue where our numbers are not where they need to be. We need an accurate count, not only for federal representation, but federal dollars. In 2010, 69.5% of the county households mailed back their 2010 census questionnaire. That's 69.5%. Requiring more costly and difficult in-person follow-up to enumerate the remaining 30.5%. Based on the latest census estimates, approximately 63% of Sullivan County's current population, or 47,690 people, lives in hard-to-count neighborhoods, where almost a quarter or more households did not mail back their census questionnaires in 2010. Without higher self-response, more households in these and other neighborhoods in the state are at risk of being missed in the 2020 census. Some populations historically have been or are at risk of being missed in a census of disproportionate high rates. These include people of color, single-parent households, immigrants, low-income populations, people with limited English proficiencies, people living in multi-family households. If these groups and their communities are not counted fairly and accurately, they will be deprived of equal political representation and vital public and private resources. So please, fill out the census. It's important to the county in which you live. And with that being said, I'd like to thank Josh and Nancy for joining us today, and our guest, Lori Orestano James. It was great to get insight into what Lori addressed today with public education, our teachers, our students, and the challenges that they're all facing. So with that being said, have a good day, stay safe, and bye for now.